Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae. The temporomandibular joint.
Good. You did that good.
It's fine, but I'm going to call it TMJ from now on. They act like a sliding hinge connecting your jawbone to your skull, and it lets you move your jaw up and down, side to side, so that you can talk, thank goodness, chew, and yawn. TMJ disorders can cause pain in your jaw joint and in the muscles that control jaw movement.
In most cases, the pain and discomfort associated with TMJ disorders is temporary, and it could be relieved with self-managed care or non-surgical treatments. But if conservative measures don't work, some people with TMJ disorders may benefit from surgery. Here to discuss is oral maxillofacial surgeon Dr. Jonathan Fillmore, DMD, MD. And I saw that on your name tag, and I said, I've never seen that before. DMD, MD. What does it mean?
DMD is just a dental degree equivalent to DDS. Some say Doctor of Mall Dentistry or Mass Destruction, but it's just a dental degree that's awarded by some dental schools.
Welcome to the
dentist.
program. Yeah, I'm all dentist. Welcome to the program, Dr. Fillmore.
Thank you
Great to
very
have
much.
you.
How common are TMJ disorders?
That's a great question. The estimated incidence in adults in the United States is about 5%. So the best information we have right now is about 6% for women and about 3% for men. But there's some ongoing studies that are shedding new light on that right now.
So we can, sorry.
Go ahead.
So we can get our audience oriented. You can actually feel your TMJ joint, can't you?
Yeah, if you press just right in front of your ear and you open and close, you can feel a little bulge, and that's common. It feels like it's right under the skin, but actually it's about 1 inch to 1.5 inches deep. It's just that the joint is very well transmitted through the skin there.
Here's where you're going to want to watch this on YouTube, because both of us went, ah.
There it is. Yep.
Got it.
Okay, how do you know, though, that you've got trouble with your TMJ, with that area?
So the main problems are with dysfunction that involve opening and closing or chewing, and most of it has to do with either pain or if you have a problem with the actual motion where you might have some locking or things like that. And I would hasten to say that a lot of times people will say, well, I have TMJ, which is a place, and a TMD, being a temporomandibular disorder, is a little bit more specific, but it can involve problems with the bone and the joint, but it can also involve problems with the surrounding musculature. And so sometimes those are easily confused, and sometimes even for a doctor, difficult to distinguish.
But not for a DMD, MD.
When you have tension in your jaw, I mean, when I hear people saying I've got problems with that TMJ, my jaw is really, is that part that leads to a problem with your TMJ?
Yeah, so you can have problems with jaw posturing or with grinding and clenching. Those commonly will cause problems associated with the powerful muscles that close your jaw. The masseter muscles, the one that you can feel when your jaw bulges out on the side when you clench down, or your temporalis muscle up here on your by the temples you can feel. And so those often will become sore when people have those clenching or grinding or jaw posturing habits, when they carry a lot of tension in their jaw. In some cases, those can contribute toward having problems with the joint itself because it increases the load that you're putting on the joint. But in many cases, it's mostly a muscular problem.
Now tell us about the joint itself. I mean, there are these two bones that are connected, and isn't there a little disc or in between the two bones to help cushion the motion?
That's right. So the base of your skull is I guess you could say it's the socket portion, and the ball portion is part of your lower jaw or your mandible. And they slide, and like you said in the beginning, it's a sliding hinge. And the disc is a pad that helps kind of negotiate that movement as it moves back and forth.
And that can wear out.
It certainly can. You can have tears in it. It can have a hole in it. It can become displaced anteriorly, so forward, where people will get kind of stuck on it and have a hard time opening, things like that.
Yo, that's got to be terribly painful, or is it just bothersome?
That's another great question. So in many individuals, the disc does get out of place, and they'll have a click. The click is usually painless, and that's okay. If you have normal range of motion and you have a click in your jaw, It's extremely common. I got a brother-in-law who's always begging me to fix the click in his jaw, and I just say, I'm not touching you. You're going to be okay. But if it becomes a painful click, or if you have a problem where you had some clicking and then it's gone and you can't open anymore, you're probably stuck behind that disc. You could go on to adapt, or you may be a candidate who needs surgery.
May I demonstrate?
Ah! Oh my gosh!
You're going to make
I got it bilateral.
I wish you would have told me you were going to do that. Yikes!
Yeah, so you probably
Do I
have
need
some
surgery, doctor?
You don't need surgery. You probably just have some arthritis in both of those joints where the disc is perforated, and I've got a perforation in one of mine too, and we're both going to make it.
At this young age, I've got arthritis in that joint.
I'm going to need surgery. My spine just shot out the top of my head. Are you kidding me? Okay, so how do you fix problems? TMD. How do you fix problems in the TMJ?
Good question. So there are, as you mentioned before, there are lots of temporomandibular disorders, or TMDs, that are self-limited, meaning they'll go away with time, up to about half or sometimes even more depending on the study. So a lot of the muscle problems, I don't have a surgical fix for that. Physical therapy and really conservative measures like some medications or moist heat and behavior management, those things are most helpful.
What about acupuncture?
There are some very preliminary evidences that acupuncture can help, but I think it's more in helping muscle relaxation and chronic pain management.
And I have had friends who have been sent for physical therapy for this problem.
Yeah, it can be helpful. Usually it takes quite a commitment for quite a while, but especially for the muscular problems, it can be helpful in helping reduce inflammation and pain in the surrounding muscles.
And then when is it time to think about surgery?
So if you have an episode where you can't open very well all of a sudden, where you have a kind of a locked feeling, if you have recurrent dislocation where you open really wide and then you can't close your jaw, and maybe you need to go to the emergency room or see a physician to get your jaw closed, that's, once or twice in those scenarios, it may resolve, but if it's a recurrent thing, then you probably should have that checked out and be considered for surgery. If you have really bad arthritis and pain on opening or closing down, or you have a change in your bite, things like that, we do anything from really small arthroscopic procedures where we look around in the joint and wash it out to total joint replacement surgeries. So.
I've been sort of worried about that locking thing you talked about, and if you end up having to go to the emergency room, and how do they get it closed?
So
I'm not sure. I want to know.
Good question. So if you're locked open, usually it requires a little bit of sedation, but to help the muscles get relaxed. But you can hold on to the lower jaw and just basically push it down and then push it back to get around that kind of ramp that the jaw goes down when it opens.
You talked about joint replacement.
Stop it! I need to leave the room now.
How successful is joint replacement there?
It's actually quite successful if you're choosing the right patients, and that's of course critical for any surgery. The data that we have right now has been going for about 20, 25 years, and we see that lots of patients, especially those with bad arthritis, are doing very well. We haven't seen lots of problems with mechanical failure of the joints, so it's very successful in terms of reducing pain and improving function.
So everything you wanted to know about the TMJ and a little bit more.
It occurred to me that I'm the one who says it's time to wrap it up. Let's wrap this up.
We've been talking with oral maxillofacial surgeon Dr. Jonathan Fillmore about jaw pain and the TMJ joint. Thanks so much for being with us, Dr.
You bet.
Fillmore.
Thanks so much.
Good to have you.